I would have checked the doctor's orders and gathered all my supplies and washed my hands when I came in the room.
Now, with this,
And then I would provide privacy. Make sure that the bed breaks are on. Hi, my name's Megan. I'm a nursing student from Cedarville University. I'm just going to raise this bed while I introduce myself. The doctor has just asked me to change the dressing on your central line IV today, so that's what we are going to do. It should take 5 to 10 minutes. Do you have any questions or anything? No? Alright. That's good. I'm just going to look at your ID band. Can you tell me your name and date of birth? Alright. I'm just going to look at this site. Try to keep you as decent as I can. Alright. Bring this table over here with my supplies on it. And I'm also going to need to grab a pair of gloves.
so I'll do this.
Alright.
All right. So when you said
I'm just going to take this off and I'm going to pull it in the direction of the wound so it doesn't pull the skin apart. I'm going to look at the dressing. I'm going to check the drainage. I would document the type, amount, and if there was an odor, and the color of it. The color could be serous, which is clear. It could be serosanguinous, which is a mix of blood and like plasma, so it's kind of pinkish. Or it could be sanguinous, which would be bright red, active, bleeding, is what that would indicate. Or it could be purulent, which is like a yellow, brown, green color, and it would be very foul smelling if that was it. And that would indicate infection. So then I'm just going to throw that away. And then I'm going to inspect this site. I would be looking for redness, swelling, drainage, and I would want to make sure that I can see where it's healing. If there were staples, I would make sure that they were intact and not pulling apart or anything like that. I can go ahead and throw these gloves away. And now I can set up my sterile field. I would have checked the expiration date on this sterile saline. If the hospital protocol was to wear goggles and a mask, I would go ahead and do that. I'm just gonna open everything up. Mask out. Grab my sterile gloves out of here. Make sure my hands are away from the table and myself. Rearrange my fingers. Alright, there we go. Alright, now with my non-dominant hand, I would contaminate it, and if I had something to pour this into, I would pour it into it, And now this hand is clean. So now I can use these swabs, and I would gently clean around the site in a back and forth motion until that was clean. And then I would just throw that away, and then I would dab the skin dry around that. Now I'm using Clean Technique, so I would go ahead and apply the new bandage, and then you can put the Tegaderm over the gauze. And then with a piece of tape, I would label my initials, the date and the time, and that's all I put on there. And then I would clean up my supplies and for my patient, make sure they were comfortable. I would lower the bed and make sure that the bed brakes were on and that the call light was in reach. Is there anything else I can do for you? Alright, if you need anything, just press your call light. And I would make sure that I documented everything that I did and how the patient tolerated it.